Hi, I'm Peggy Finnegan. I'm a breast cancer survivor. 13 years ago, I had a double mastectomy and reconstruction. At the time, I was the mother of two young children, one an infant, and I was working full-time as a newscaster in Pittsburgh. Took me a long time to recover and to be able to get back to the life I had before surgery. If you've been diagnosed with breast cancer, if you're being treated for breast cancer, or if you've already had your surgery, you know what I mean. As you go through the recovery process, it's going to be very important that your focus is on you. As women, we tend to care for others, often neglecting our own needs. But now is the time to put you first. You need to make sure you're getting enough sleep, eating healthy meals, exercising, and talking with others about what you're feeling and experiencing. Breast cancer treatment may involve surgery, radiation, chemotherapy, hormonal therapy, or a combination of these. Some women may have a lumpectomy, others a mastectomy, like me with reconstructive surgery. Some women may have a sentinel node biopsy, others an axillary node dissection. No matter what treatment you experience, it's likely to affect your upper body strength and mobility. Now that may sound scary, but don't worry. You can get back to your normal routine. You can do the things you used to do. That's what this program is all about, helping you find the courage to fully recover and showing you how to regain your upper body strength. I promise you can get there. Now, right now, you may be wondering the same things that these breast cancer survivors did when they were going through their treatments.
As soon as I found out that I have to have lymph node dissections, my first question was, will I be able to play golf? And my surgeon said, yes, definitely, if you do your exercise in proper ways.
Right after surgery, I really didn't feel all that bad, but didn't realize until later when the physical therapist came in to visit with me. He asked me to raise my arm, and using the utmost effort that I had, the highest I could raise my arm was to my shoulder. I wanted to be the mom I always was. I didn't want things to change as far as my physical abilities with my children.
I was really surprised at the amount of inability that I had with my arm and how we use our arm for everything. All I wanted to do is just be back to the way I used to be, with no pain, with no limitations, no soreness, no stiffness, nothing.
With the right exercise program, you can regain your strength and mobility. You can regain control of your life. That's what Dr. Sharon Cowden, a breast cancer survivor, did when she teamed up with Jeanette Poppenberg, a personal fitness trainer.
In 2002, I was diagnosed with breast cancer. I had surgery, I had a lumpectomy and an axillary node dissection. And after that surgery, I really realized that I had lost a lot of power in my arm and movement in my shoulder, and I needed to get it back. I'm a pediatrician, I lift kids all day long, I lift a lot of kids, and I wanted to return to my favorite sport, golf. I wanted to rejoin my friends and just to have fun again.
I'm a personal fitness trainer, certified by the American College of Sports Medicine, and a friend introduced Sharon and I to help Sharon regain her strength and flexibility in her upper body after her breast cancer treatment.
There's a lot to go through in breast cancer. You have surgery, radiation, some women go through chemotherapy. So you're going through a lot, but you think at the end you're going to get through this and do exactly what you did before. But that isn't always the case.
Knowing what she had gone through, we decided that it was something that she had to do very slowly. I'm a very conservative trainer, and so we wanted to use smaller weights and less repetitions.
It was slow. The progress was slow, but it was steady, and I felt good, and that I could see that I slowly was regaining what I had lost.
Once the form was down, increased weights came faster, and before long, Sharon was able to lift children again for her practice, and definitely had some long drives on the golf course, which was important, and she was accomplishing her goals.
I think as women, we use our upper bodies a lot. We use it in our jobs, in our hobbies, but in our homes also. We're lifting our own children. We're opening cabinets. We're making our beds. We're doing all of these things repetitively. And so it really is important just to have this strength back again, to know that you can do the things that you used to do.
More and more physicians are discovering the benefits of exercise for their breast cancer patients. Dr. Adam Brufsky, co-director of the breast cancer program at Magee Women's Hospital, an affiliate of the University of Pittsburgh, has been treating women for more than 15 years.
I'm a medical oncologist who treats a large number of breast cancer patients. And initially, after surgery, when a lot of patients come to me for chemotherapy, they can experience some weakness in their arm. A lot of patients experience swelling of their arm, lymphedema, fatigue, anxiety, nausea, and some patients do gain weight. We do have patients who have trouble sleeping after their therapy and even during their therapy. And this can make people fairly depressed and kind of miserable with their overall condition. There is a lot of very interesting research out there that suggests that modest amounts of weight training, resistance exercises, as well as modest amounts of aerobic exercises actually can combat many of these symptoms that women experience both after surgery, after radiation, and after chemotherapy. Some of the newer hormonal therapies for postmenopausal women, drugs called aromatase inhibitors, which are anti-hormonal agents that appear to be superior to tamoxifen for treatment of breast cancer, have as one of their major side effects bone loss and osteoporosis. Normally, these women could take calcium and vitamin D and could take drugs like Actonel and Fosamax. One thing that we don't emphasize as much that I think should be emphasized is that a modest aerobic program as well as a modest resistance training program really will have substantial benefits in preventing osteoporosis and osteopenia in the vast majority of these women. All it is requires a little bit of motivation, just taking those small steps. But the benefit at the end of the day can be dramatic. You can get back to being you.
Now, let's restore your strength and courage. In Chapter 1, our physical therapist will demonstrate the basic posture exercises that are so important to do as soon as possible after surgery. In Chapter 2, you're going to learn the upper body post-op exercises you will need to master before moving on to the exercises in later chapters. Chapter 3 is flexibility training. We advise you to always complete this chapter before moving on to weight training. In Chapter 4, you will learn the weight training exercises you will need to rebuild and advance your strength. And finally, in Chapter 5, we will suggest some aerobic training guidelines. Don't forget to check out the special features section of the DVD. Here, we've included specific information on lymphedema and breast cancer, as well as a printable exercise log. You can access the log by putting this DVD in any computer with a DVD drive. I am proud to share that all of these exercises are performed by breast cancer survivors, women who have been through what you are experiencing now. If you can follow this exercise video, you may even feel stronger than you did before you had breast cancer. It really will help your body and your mind heal faster.
Stand up straight, don't slouch. Do you remember when your mom would say that? Well, she was right. We tend to have very poor posture. Following surgery and treatment for breast cancer, posture exercises become particularly important. And the normal healing processes of surgery, together with a natural tendency to protect the area of a recent operation, result in the shortening of chest muscles and the stretching and weakening in the muscles of the upper back. Radiation treatments can magnify these results, and they can be progressive over time. Posture exercises will stretch the proper muscle groups and tone the muscles that are weak. These exercises can generally be started 24 hours post-operatively if you get the okay from your physician. The exercises should be performed slowly and within your pain tolerance. Keep the motion smooth without any bouncing. 5 repetitions performed twice daily can be increased to 10 repetitions performed twice daily as your circumstances allow. And finally, always remember to breathe while performing all of your exercises. Let's start with some gentle range of motion exercises for the neck. The first exercise is neck rotation. Turn your head to the right and look over your right shoulder. Hold for 3 seconds. Turn back to the starting position and then look over your left shoulder for 3 seconds. And turn to the center. Let's perform 5 repetitions of this exercise. Turn to the right, hold for 3, and to the left, hold for 3. This motion should be coming from your neck. Don't turn your upper body. Full motion in this direction will be helpful in parallel parking your car. To the left for 3 seconds and straight ahead. And always remember to breathe during your exercises. To the left and relax. The next exercise for neck range of motion is neck side bending. With your shoulders back and eyes straight ahead, bend your head to the right, as if you were trying to put your right ear on your right shoulder. Hold for 3 seconds. Return your head to the upright position and tilt to the left. Hold for 3 seconds and return to the starting position. Now we'll try 5 repetitions of this exercise. Tilt to the right, hold for 3, and to the left, hold for 3. Back to center and to the right for 3 seconds, and to the left for 3 seconds. Okay, remember this motion also comes from the neck. Try not to lift your shoulder up to meet your ear. And to the right for 3 seconds, and to the left for 3 seconds. And one final repetition, to the right for 3 seconds, and to the left for 3 seconds. And relax. This next group of posture exercises will help to stretch our chest muscles and strengthen the muscles of the upper back. The first exercise is a shoulder shrug. So in a proper posture position with your shoulders back and your shoulders level, lift your shoulders towards your ears, hold for 3 seconds, and slowly lower to the starting position. Let's perform 5 repetitions of this exercise. Lift your shoulders up, hold for a count of 3, and slowly lower to the starting position. Lift, hold for a count of 3, and slowly lower. And again, lift up, hold for 3 seconds, and slowly lower. You want to control the contraction as you lower your shoulders. One final repetition. Lift your shoulders up, hold for a count of 3, and relax. The next exercise in this group is a shoulder backward circle. With your arms relaxed at your side, bring your shoulders up and circle them backwards. Let's perform 5 repetitions of this exercise. Up, circle around. Movement on this exercise should come from the shoulders. 2 more repetitions, and up and around, and up and around, and relax. The final exercise in this group for the strengthening to the upper back muscles is a scapular retraction exercise. Again, with your arms relaxed at your side, eyes straight ahead, squeeze your shoulder blades together, hold for a count of 3, and relax. Let's perform 5 repetitions of this exercise. Squeeze your shoulder blades together, hold for a count of 3, and relax. Squeeze your shoulder blades together, hold for a count of 3, and relax. Remember to keep breathing. It's a normal tendency to hold your breath when you're holding a muscle contraction. So a helpful tip might be to count out loud when you're holding this muscle contraction. Okay, and one last repetition. Squeeze your shoulder blades together, hold for a count of 3, and relax. In a few months, when your neck and shoulder range of motion have returned to within normal limits and you're performing all of your daily activities, there are a few advanced exercises you may want to add to your posture exercise program. You should begin performing these exercises for 5 repetitions and increase to 10 when you feel comfortable. The first exercise in this group is called the W exercise. In a proper posture position with your spine straight, shoulders back, arms at your side with your palms facing forward. If you look in the mirror, your arms and upper body look like the letter W. Squeeze your shoulder blades together and point your elbows downward. Hold for a count of 3 and relax. And we'll perform 5 repetitions of this exercise now. Squeeze your shoulder blades together, hold for a count of 3, and relax. You should feel the muscle contraction in between your shoulder blades. Again, remember that when you're holding a muscle contraction, to continue breathing. And squeeze your shoulder blades together, hold for 3, and relax. And one final repetition. Squeeze your shoulder blades together and relax. The next exercise in this group is called the V exercise. With your arms at your side and your thumbs pointing forward, lift your arms straight up over your head. And yes, we look like the letter V. Hold for 3 seconds and return to the starting position. And now we'll perform 5 repetitions of this exercise. Leading with your thumbs, arms up overhead, hold for a count of 3, and slowly return to the starting position. Remember to keep your palms facing inward. Hold for a count of 3, and return to the starting position. It's important to lead with your thumbs throughout this exercise when you're coming forward. You should feel the muscles contracting right below your shoulder blades in this exercise. And one final repetition. Up, hold for a count of 3, and relax. The last exercise in this group is called the money exercise. With your spine upright, put your arms out to the side at shoulder height and turn your palms up toward the ceiling. Squeeze your shoulder blades together, hold for a count of 3, and relax. Let's do 5 repetitions of this exercise. Squeeze your shoulder blades together, hold for a count of 3, and relax. Again, squeeze your shoulder blades together, hold for a count of 3, and relax. It's very important during this exercise to keep your arms straight out from your shoulder and your palms facing the ceiling. This is so you don't get any pinching at your shoulder joint. You'll actually feel this contraction in the muscle groups just above your shoulder blades. And one final repetition. Hold for a count of 3 and relax. Congratulations, you've just finished the posture exercise program. While breast cancer treatments have a defined time course, the consequences of these treatments on your musculoskeletal system can continue to progress. The posture exercises you have just completed have a place in the present and in the future. We encourage the commitment on the part of a proactive patient to continue these exercises for a lifetime. Shoulder exercises are designed to increase your motion and strength following your surgery. These exercises are generally started after your drains have been removed, but always get the okay from your physician. The exercises should be performed slowly and within your pain tolerance. Keep the motion smooth without any bouncing. Begin performing each exercise for 5 repetitions, 2 to 3 times a day. When you feel comfortable, increase the number of repetitions to 10. Now let's get started. The first shoulder range of motion exercise we will be performing is the wall walk. This is a very well-known exercise for women to perform when they're recovering from surgery for breast cancer. Facing a wall with your feet about 6 inches from the wall and shoulder width apart, have a slight bend in your knee. Place your hands on the wall and slowly walk your fingers up the wall until you feel a stretch. When you feel the stretch, hold for 3 seconds and slowly slide your arms down the wall. Let's perform that 5 times. Walk up the wall. Feel the stretch. Hold for 3 seconds and slowly lower your arms. With each repetition, try to go up a little higher on the wall. Hold for 3 seconds and slide your hands back down. Again, up the wall. As you get farther up the wall, you'll need to start stepping in towards the wall. Feel the stretch and slide your hands down the wall. Again, up the wall. The goal of this exercise is to get your underarms right up against the wall. Lean in, feel the stretch, hold for 3, and slide your hands down the wall. And one final repetition, up the wall, as high as you're able to go. Feel the stretch, hold for a count of 3, and slide back down the wall. When you feel ready, increase this exercise to 10 repetitions. The more motion you get at your shoulder will just make you feel so much better. The next 3 shoulder exercises are performed on a flat surface, like your bed. Lying flat on your back with your knees bent to help take some of the pressure off your low back. The first exercise will help to increase your forward motion at your shoulder. With the towel placed between both hands, shoulder width apart, slowly lift up overhead until you feel a stretch at your shoulder. Hold for 3 seconds and slowly lower to the starting position. Let's try that for 5 repetitions. Lift up over your head, feel the stretch, hold for 3, and slowly lower. When you first begin this exercise, you might not be able to reach overhead very far, but with each repetition, try to go just a little bit farther. The purpose of the towel is so that the unoperated arm can do the work and assist your arm that had surgery. Eventually, you'll be able to reach over your head. When you get to this point, you can try this exercise without the assistance of the towel. With your hands at your side, thumbs pointing up, reach up and back overhead as far as you can. Hold for 3 seconds, feel the stretch at your shoulder, and return to the starting position. Now we're going to work on another shoulder motion. With your arms relaxed at your side and your thumbs pointing upward, slowly move your arm away from your body. When you feel the stretch at your shoulder, hold for 3 seconds and return to the starting position. At first, you might not be able to move your arm very far, but be persistent and you will gain more motion with each repetition. When you get to the point that you can move your arm straight out from your shoulder, turn your palm upward and continue moving your upper arm towards your ear. Feel the stretch at your shoulder, hold for 3 seconds, and return to the starting position. Eventually, you'll be able to move your upper arm to your ear and achieve your full range of motion. Let's do the last shoulder exercise. Place your hands in the nape of your neck and interlock your fingers. Move your arms to the side as if you were trying to place them flat on the bed. You will feel a significant stretch across your chest and into your shoulder. Hold for 3 seconds and relax by moving your elbows together. At first, you won't be able to go very far, but keep trying. Eventually, you want to be able to flatten your arms on the bed. This is a simple exercise, but very important in gaining full range of motion at your shoulder.
Before any stretching, you're going to need to warm up your muscles. This is to help avoid injury. To warm up, do at least 5 minutes of low to moderate intensity aerobic exercise. Walking, jogging, or bicycling are all good aerobic exercises, but you could also simply walk around your house. The goal is to use your large muscle groups and moderately elevate your heart rate for 5 minutes.
These stretches will be more advanced than the stretches done earlier in the posture section of this program. The correct way to form a stretch is to relax and sustain the tension of a muscle, paying all the attention to the muscle being stretched. Tightened muscles will loosen and the movement will become easier. A typical stretching routine is to move the muscle creating a tension, don't bounce, hold the stretch, feel the tension diminish. Breathe naturally through the stretch. It is also helpful to do one side of the body and then repeat the same sequence on the other side of the body. This provides a complete stretch of the muscles without contracting the muscles already stretched. The following stretches are for the muscles along the side of your body, from your arms to your hips. These stretches can be done anytime, anywhere, and they will help you for the rest of your life. To get started, let's have our feet pointed straight ahead, our knees slightly bent, and our legs should be shoulder width apart. For the first exercise, we're going to interlock the fingers and press them up to shoulder height. Press it out. Feel the stretch in the arms, the shoulders, and the upper back. Hold the stretch for 10 to 30 seconds. Breathe through the stretch as you feel the tension leave your body. Now let's take the arms up overhead. Press them up and slightly back. Hold this stretch for 10 to 30 seconds. Drop one arm to our waist. With the other hand, pull over to the side. Move slowly and controlled. Hold this stretch for 10 to 30 seconds. Come back up to center and relax the arms. We'll now stretch the side of the neck and the top of the shoulder. To do this, drop the ear to the shoulder. At the same time, grab your wrist behind and pull the arm over in the same direction as the head. Hold this stretch for 10 to 30 seconds. Breathe through the stretch. Feel the tension leave. Relax the arms. Take both hands up overhead, grab the wrist, pull it up. And now let's pull over to the side. Feel the stretch from the arm to the shoulder, down the side. Hold the stretch for 10 to 30 seconds. Come up, back to center. Drop the hand behind our head. Press the elbow down, stretching the triceps and the top of the shoulders. Hold this stretch for 10 seconds. Pull the elbow to the side. Hold this stretch for 10 to 30 seconds. You should feel the stretch in the side of the arm and the body down to the hip. Breathe through the stretch. Come back up to center and relax the arms. We have now completed the sequence on one side of the body. Now let's try the same stretches for the other side of the body. Once again, interlace the fingers, bring them up to shoulder height. Remember that those knees are slightly bent. Press the arms out. Feel the stretch in the upper back. Raise the arms over our head. Press the arms up and slightly back. Hold this stretch for 10 to 30 seconds. Drop one arm to the waist. Put it on the hip for support. With the other hand, bend at the waist. Feel the stretch go down the arm, through the shoulder, to the hip. Hold this stretch for 10 to 30 seconds. Breathe through as the tension leaves our body. Come back up to center and drop the arms. To now stretch the side of the neck and the top of the shoulder, drop the ear down to the shoulder. At the same time, take the hands behind our back, grab the wrist, and pull the arms over in the same direction that you do with the head. Hold this stretch for 10 to 30 seconds. Relax. Bring both hands overhead, grabbing at the wrist, pulling up. Make sure those knees are bent. Pull it over to the side at the waist. You should feel the stretch in the arm, the side, and the shoulder. Breathe through the stretch. Come back to center. Drop the hand behind your head. Place the other hand on the elbow and press it down. Hold the stretch for 10 seconds. Feel the tension leave your body. Pull the arm over to feel the stretch go down the body to the hip. Hold this stretch for 10 to 30 seconds. Come back to center and relax the arms. We're going to finish our stretching section with 3 final stretches. Interlace the fingers behind our head. Press the elbows back and the shoulder blades together. Feel the tension in the upper back and the shoulder blades release itself. Relax the arms. Put one arm across the body. Press the hand in. Hold this stretch for 10 seconds. And now switch arms. The other arm comes across the body and the hand presses it in. Press it in. Feel the stretch in the middle of the upper back. Hold this stretch for 10 seconds. Lower the hands. Interlace the fingers from behind. At this point, you want to push the shoulders back. Roll the elbows in toward each other. Pull the arms up. Feel the stretch in the arms, the shoulders, the upper back. Relax the arms. Your muscles are stretched, and now we're ready to lift weights.
This chapter demonstrates 8 weight training exercises to improve your upper body strength. Now, no one should begin weight training until you're cleared by your doctor. If you get the go-ahead, here are some things you'll need to know before you begin. Wear comfortable, stretchy clothing like sweatpants or shorts and a t-shirt. Also, wear sneakers if possible. You're going to need to have 2 1-pound weights to perform these exercises. Find a place in your home where you have enough space. You will also need an open wall and a chair to do some of the exercises. Many people tend to hold their breath while lifting weights. Don't do that. Doing so can lead to unsafe temporary increases in blood pressure. If you find yourself holding your breath, focus on breathing in as you do the first part of the exercise and breathe out as you return to the starting position. For many of the exercises, we'll show you a second version in a modified body position that you may find easier. This is targeted for those of you who may be at risk for lymphedema, but also for anyone who feels their body needs to take it easy on any particular day. You'll want to do these exercises at least 2 times a week. However, only lift weights every 48 hours. If you lift more than once in 48 hours, you risk straining your muscles and having a setback. As we go through the exercises, we'll need to remind you to pause after each set. A set is 10 repetitions or reps. We're going to do 2 sets of each exercise. It's best to pause the DVD after each set and wait for about a minute to allow your muscles to recover. Now, we're ready to get started. A precaution to those with lymphedema or at risk for lymphedema. Please review all lymphedema precautions given to you by your surgeon or physical therapist. On the web, you can visit lymphnet.org to find a qualified therapist in your area. To reduce the risk of lymphedema, listen to your body. When weight training, advance slowly, both in weight and repetitions. Don't hurry. If you develop more muscle soreness on the affected side than the unaffected side, rest for a day and return to a lower weight. If you develop arm swelling, stop exercising for a day and return to a lower weight. If soreness or swelling persists, contact your physical therapist or a certified lymphedema specialist. And if you have lymphedema, wear a well-fitted compression garment during exercise.
Before we get started with our weightlifting exercises, there are two things we need to keep in mind about body positioning. The first one is something we will refer to as our posture rectangle. This is where the shoulders are directly aligned above the hips, placing the low back in a slight arch, which is in the neutral position. The second one is with our arms. The hand that is holding the weight should have the fist, wrist, and forearm always in alignment, so we're not overflexing the wrist in either direction. We do this to ensure proper form and to prevent injury. Now, keeping this in mind, let's get started. Now that you've completed the wall walk, you're ready to graduate to the wall push-up, which is the first exercise in our weightlifting exercise series. This exercise will be done using our body weight and not handheld weights. To do the exercise, we stand facing a wall with our toes pointed directly to the wall. You want the shoulders directly above the hips. Place the hands in front of the shoulders and take them straight out until you reach the wall. As we press our bodies into the wall, the elbows go wide and we press it back out. Let's do 10 repetitions. Press it in for 1 and out. Inhale for 2, exhale coming out. For the modified position, lunge forward with your dominant leg, placing your toes and hands against the wall. Don't forget to keep the head, neck, and shoulders in alignment. The modified position can relieve the stress on the wrist and lower back. It has the potential of slightly increasing the workload in the lower body. And the last one, take it in slowly, press it out, and relax the arms. We're ready to do the second set of the wall push-ups. Once again, place the hands in front of the shoulders, press them out to the wall, and now we're going to press our bodies in with the elbows going wide. Press it in for 1, and exhale coming out. Don't forget to keep those knees slightly bent. The head, neck, and shoulders should always be in alignment as we press our body in and out of the wall. Last one. Relax the hands. You did a great job. To protect the shoulder and chest, do not perform this exercise with weights weighing more than 3 pounds each without guidance from a certified fitness professional. We're going to continue our exercises on the wall, but this time our back will be against the wall for the standing chest press. To get into position, stand against the wall. Bring the feet out about 10 inches from the wall, toes pointed forward, feet about shoulder width apart. Slightly bend the knees and check that posture rectangle to make sure that the hips and shoulders are against the wall. With a weight in each hand and knuckles facing out, palms facing the wall, we're going to raise our arms to 2 90-degree angles. We now want to press the weights to the center, keeping a slight bend in the elbow, and press it back to the wall. Let's do 10 repetitions. Press it out for 1 and in. This modification will provide less stress on the lower back and body by doing the exercises in a seated position with your back supported. 4 and out, always keeping a slight bend in the elbows and the knees. Out for 6 and back in. Inhale out for 7. Exhale as we take it back. trying to keep the arms parallel with the floor. And back. Out for 9. And back. Last one, take it out. Bring it back in slowly. Relax the arms. Place the weights on the floor. And stand to relax to prepare for set number 2. We're now ready to do the second set of the standing chest press. Once again, raise the arms to shoulder level, creating 2 90-degree angles. And press the weight out 1 and back in slowly. 2 and back. 3 and back. Keep the knees slightly bent. Inhale as we go out. Exhale coming in. 5 and back. 6 and back. 9 and back. Last one, take it out. Bring it back slowly and place the weights on the floor. Good job. The next exercise is for the front deltoid, which is the front of the shoulder. In this exercise, it will assist you with things like lifting your child or grandchildren. To do this exercise, we want to sit up tall in our chair, making sure that our posture rectangle is in place, shoulders above your hips. Place the weights in your hands. Put your arms alongside of your body, knuckles facing out, palms facing to the back. To do this exercise, you lift your arms up to shoulder height, parallel with the floor, with a slight bend in the elbow, and then slowly control the motion as you bring the arms back down. Let's do a set of 10. And lift it up for 1, and down. Inhale out, exhale in. Inhale up for 3, and lower it down. Up for 4. Keep a slight bend in those elbows as you bring it back down. Up for 5, and down. Bring it up and down. Check your wrist. Make sure that the fist, wrist, and forearm are in the proper alignment. Bring it up for 8. Exhale, coming down slowly. Up for 9. And down. Last one, bring it up. Slowly control the motion as we come down. And let's place the weights in our lap to rest before we do the next set. Let's now do the second set of the front deltoid exercise. Again, with our arms to the sides, bring it up. Inhale up 5 and down. Up for 6 and down. Bring it up for 7 and down. Inhale 8 and down. Up for 9 and down. Last one, bring it up. Slowly bring it back down. Place the weights in your lap to relax. Good job. The next exercise is the lateral raise, in which we will continue to work the shoulder. To do this exercise, we want to sit up straight in our chairs with our posture rectangle in place, shoulders on top of hips. Let's place the weights in our hands and take them to our sides. To do this exercise, we're going to lift the arms up to the sides with a slight bend in the elbow, even with the shoulders parallel with the floor, and then slowly take it back down in. Let's do 10 repetitions. And inhale, bringing it up for 1, and down. For the modification, lift your arms in a forward V, elbows slightly bent, weights vertical. Lift only to shoulder height. Inhale up for 4, Exhale down. Keep the shoulders relaxed and low. The modification puts less stress on the shoulder joints. Inhale up for 6 and down. Inhale up for 7. Keep a slight bend in those elbows. Bring it up for 8 and down. 9 and down. 10 and relax. Put the weights in our lap and rest as we prepare for the second set. Let's do the second set of the lateral raise. Let's place the weights in our hands and take our arms down by our sides. Take a deep breath in as we lift up and exhale as we come down slowly, controlling the weight. Inhale up and down. Bring it up for 3 and down. 4. Exhale, coming down. Relax the shoulders. Bring it up for 5 and down. Inhale up 6. Exhale down. Up for 7. Keep the elbows slightly bent. Bring it down. Up for 8 and down. Remember, those shoulders remain right above the hips. Bring it up for 9 and down. And the last one, bring it up. Slowly bring it back down. Place the weights in our lap to rest and get ready for the next exercise. This exercise is for the rear deltoid, or the back of the shoulder. We want to stand to the side of our chair. With the arm and leg closest to the chair, we'll put the knee and fist on the seat. For the modification of this exercise, stand parallel to a surface the height of a countertop. Lunge forward with your inside leg. Your knee should not extend past your toes. Place your forearm on the countertop, elbow directly under your shoulder. Bend slightly forward at your hips. Go ahead and pick up the weight with your outside arm, palm facing into the chair. Slowly lift the weight up towards the torso, elbow bent, and take it back down. Let's do 10 repetitions. Inhale, bringing it up, and exhale, coming down. Up for 2, and down. The modification of this exercise places less strain on the wrist, back, and knee. Make sure the head, neck, and shoulders stay in alignment. Eyes should be on the floor. Inhale up, take it down, up for 7, and down. Relax the shoulders, bring it up, and down, up for 9, slowly controlling it, bringing it down. Last one, bring it up, exhale, coming down, place the weight down, and bend the knees to stand. Now we're ready to start the second set of the rear deltoid. Place the knee and fist on the chair. Pick up the weight and lift it up for 1 and down. Inhale for 2 and down. 3 and down. 4. Exhale, coming down. Remember to keep a small bend in both elbows as well as the knee. Lift it up. Exhale, down. Inhale up for 7 and down. 8 and down. Inhale up and down. Last one, take it up. Bring it down slowly and controlled. Place the weight on the chair and bend the knees to stand. Great job. What we do for one side of the body, we must do for the other. So let's move to the other side of the chair for the rear deltoid exercise. With the arm and leg closest to the chair, place the knee and fist on the seat of the chair. Pick up your weight. With the arm hanging down and palm facing in, lift the weight up close to the body and lower it down. Up for 2 and down. Inhale up for 3. Exhale, coming down. Make sure the elbow and knee are kept soft. Up and down. Inhale up. Take it down. Up for 7 and down. 8 and down. Inhale. Take it down. Last one. Bring it up. Lower it slowly. Place the weight on the chair. Bend the knees to stand, relax, and get ready for the next set. We're now ready for set 2 of the rear deltoid. Again, place the knee and fist on the chair. Pick up your weight and raise it up for 1 and down. Inhale up, exhale down. Make sure you keep a soft elbow and a soft knee. Inhale up and down. Take it up for 5 and down. 6 and down. 7 and down. Try to keep a flat back during the entire exercise. Bring it up and down. Last one, take it up, lower it slowly, place the weight on the chair. Bend the knees to stand and relax. Very good. This next exercise is for the tricep, the back of the arm. It will be done in a similar position as to the last exercise. Place the knee and fist closest to the chair on the seat. Lift the weight with the other hand. Raise the arm so that the shoulder to elbow are even with our bodies. Take the forearm and raise it back. Bring it in slowly in a controlled motion. Now let's do 10 repetitions. Take it back for 1. Exhale, coming in. Back for 2. And in. 3. And in. Keep the knees slightly bent. And in. Shoulders soft. Take it back. And in. Back. Exhale, coming in. And back. And in. Inhale, going out. Exhale, coming in. Take it back and in. And the last one, take it back. Slowly bring it in controlled. Place the weight on the chair. Bend the knees to stand, relax, and get ready for the next set. We're now ready to do the second set for the tricep muscle. Place the knee and fist closest to the chair on the seat. Lift the weight and take it back for 1 and in, 2 and in, 3 and in, and back and in, and back and in, 6 and in. Keep the shoulders soft, back and in, 8 and in, 9 and in. Take it out for 10. Bring it in slowly. Place the weight on the chair. Bend the knees to stand. Relax. Way to go. Now we need to do the triceps on the other side of our body. Let's go to the other side of the chair. Place the knee and fist on the seat of the chair. Pick up your weight. With the palm facing the chair, raise the arm so the shoulder to elbow are even with our body. Kick back the forearm and bring it in. In the modified version, notice she is wearing a custom-fitted compression sleeve. 3 and in. Remember to keep a soft elbow and soft knee as you do this exercise. Out for 6 and in, 7 and in. Inhale as we go out, exhale as we bring it in. Last one, take it out, bring it in, place the weight on the chair, Bend the knees to stand, relax, and get ready for the next set. We now need to do the second set for the tricep muscles. Once again, place the knee and fist on the chair. 8. Raise the arm so that the shoulder to elbow are even with our bodies. With the forearm, kick it back for 1, and in, 2, and in, 3. Exhale as we come in, out for 4, and in, 5, and in. Relax the shoulders, 7, and in, 8. Slowly control it as you bring it in, out for 9, and in. Last one out, bring it in slowly, place the weight on the chair. Bend the knees to stand and relax. Good job. We've just completed the tricep exercise on the chair, and now we're back at the wall again to do the bicep exercise for the front of the arm. To do this exercise, we want the feet to be about 18 to 24 inches from the wall. The toes should be straight ahead, the knees slightly bent. Place a weight in each hand and place our arms in front of us with the palms facing forward. Shoulders to elbows should be Velcro to our bodies. They're not going to move. We're going to be curling up our forearms. When we do this exercise, we bring the weights up to the shoulders and lower it back down slowly. Let's do 10 reps. Take it up and exhale down. Up for 2 and down. Keep the shoulders relaxed and down as we do the exercise. For the modified body position, sit in a chair with your back supported. The modification of this exercise places less stress on the lower back and body. 6 and down. Don't forget to check the alignment of the fist, wrist, and forearm. Bring it up. Exhale down. And 9 and down. Last one, curl it up. Bring it down slowly. Let's place the weights on the floor. And stand to relax as we get ready for the second set. We are now ready to do the second set of our bicep curls. With a weight in each hand and the palms facing out, let's curl the arms up to our shoulders and slowly lower it back down. Up for 2 and down. And bring it up for 9 and down. Last one, take it up, lower it slowly. Let's place the weights down and stand to relax. You're on your way to beautiful arms. The last exercise we will be doing is the shoulder shrug. To do this exercise, we want the feet to be shoulder width apart and the knees slightly bent. Toes should be pointing forward. We should have a slight bend in our elbow, and the arms are hanging at our sides with the palms facing in. We're simply going to lift up the shoulders towards our ears and bring it back down slowly and in a controlled motion. Let's do 10 together. Ready? Take it up and exhale, coming back down. Take it up for 2 and down. 3 and down. Inhale, coming up. Exhale, coming down. We're strengthening the neck and the upper shoulders. Bring it up. Take it down for 6. And bring it up for 7. Exhale, coming down. Inhale, up for 8. And down. 9. And down. 10. And down. Let's place the weights down to relax before we do the second set. Let's do the second set of the shoulder shrugs and raise it up for 1. Exhale, coming down. Inhale, up and down. Up for 3 and down. Remember to keep a slight bend in the elbow and the knees. Bring it up. Exhale, down for 5 and up. Down for 6. Inhale, up and down. That looks great. Keep it going. And down. Up for 9. Take it down. Last one. Bring it up and down. And let's place the weights out of our hands to relax. Now that we've completed the weightlifting exercises, we're going to cool down our muscles. Let's start by having our feet point forward, our knees slightly bent. We're going to interlace our fingers and push them out in front of us. Hold that stretch, filling it in the shoulders. And now we need to press up and slightly back. Let's drop one hand and pull over to the side. We should feel a stretch down the side of our body and through our arm. Coming up and relaxing the hands, we're going to grab the wrist of the hand behind us and pull it over with our heads, feeling a stretch in the neck and shoulder. Once again, let's go up, but take both arms up. Push up and pull them to the side. Remember to keep those knees soft. Standing up, let's drop the elbow and push it down. Pull it to the side. And relax both arms. Now that we've completed one side of the body, we need to do the same thing for the other side. Once again, interlace the fingers and push them forward. Feel the stretch in the shoulders, open up the shoulder blades, and pull it up and back slightly. Let's drop one hand and pull over to the side. Feel the stretch all the way through the side of the body. Bring it back up to center, relax both arms. Grab the wrist and pull the arm and head to the side, feeling a stretch in the neck and upper shoulder. Coming back to center, push both arms up. Keep a slight bend in the knee and the elbows, and pull it over to the side. Coming up, drop the elbow and press it down. And pull it over. Relax both arms. Let's interlace the fingers behind the head, press the elbows back and the shoulder blades together, opening up the chest. Let's bring one arm across our body and press it in with the other. And now switch sides. Drop both arms, interlace the fingers to the back, and roll the elbows in towards each other. Press the arms up, and relax. Your cool down is complete. If you've just completed this video and were able to do 2 sets of 10 reps of each exercise using the proper form, then you may want to increase the weight. We recommend staying at 1 pound for the first week and then increase to 2 pounds for week 2. If you cannot complete the sets with the proper form, do not increase the weight because you could put yourself at risk for injury. As you continue to improve and get stronger, you may want to increase the weight even more. Take it slowly. A 1 pound increase per week is safe up to 4 pounds. Going from 4 to 5 pounds may take time. Listen to your body. Realize that certain exercises will advance more quickly than others. If you feel you want to go beyond 5 pounds for any exercise, you should consult a certified fitness professional for guidance.
As breast cancer survivors, we all worry about the recurrence of the disease and want to do whatever we can to prevent it. Recent research concluded that even a little aerobic exercise can dramatically improve a woman's chances of surviving breast cancer.
This study that was published in the Journal of the American Medical Association several years ago suggests that as little as 1 to 3 hours a week of modest exercise can cut your risk of breast cancer recurrence by up to 20 to 50%. And that is not running a marathon, that's simply doing as little as walking for 30 minutes a day, 3 days a week.
The long-term benefits of ongoing aerobics are becoming more and more clear. Here are some tips to help you get the most out of your aerobic exercise. Aerobic exercising works the large muscles of the body, which increases your heart rate. The result of aerobic exercise is that you're going to have more energy. You may need to start slowly, even walking just 15 minutes per session. Jogging, bicycling, and swimming are all considered beneficial forms of aerobic exercise. Even dancing can be fun and aerobic. The simplest form of aerobic exercise is walking at a moderate pace. This means walking at a pace of 20 to 30 minutes per mile to begin. To begin a routine of aerobic exercise, schedule the time to exercise. This is going to help you stick to your routine and stick to the goal of 2 to 3 times per week. A typical aerobic exercise session would begin with an easy walk for the first 5 minutes, then stop and do 5 to 10 minutes of flexibility training, like the ones demonstrated in Chapter 3. A moderate pace for the next 15 minutes or more will be needed for the aerobic work. Lastly, cool down with an easy walk for 5 minutes and stretching at the end. This pattern of warming up, stretching, moderate pace aerobics, and then a cool down with more stretching can be followed with whichever type of aerobic activity you choose. As you become more comfortable with your routine, increase the length of your aerobic work by 5 minutes per week when exercising consistently. Your ultimate goal should be 30 to 45 minutes of aerobic exercise 5 times a week to feel your best.
Through an exercise program developed specifically for breast cancer survivors, you will heal quicker, both physically and emotionally. Your muscles and your bones will be stronger. If you had an axillary node dissection, with proper weight training, you may actually decrease the risk of developing lymphedema. With regular aerobic activity, you can reduce the risk of breast cancer recurring. It's my hope that through this program, you will increase your strength and find even more courage. Good luck, and may you stay in good health.
I am Dr. Catherine Schmitz, and I am an associate professor in the School of Medicine at the University of Pennsylvania in the Abramson Cancer Center. I am an exercise physiologist, and I do medical research, most of which focuses on breast cancer. Our lymphatic system is an intricate network of vessels that follow the same pathways as our cardiovascular veins that return blood and fluids back from all parts of the body back to the heart. The second part of the lymphatic system are the lymph nodes, which serve as kind of a taxi dispatcher, a place that tells the body, hey, something's come through this particular neck of the woods that tells me that there's a problem that we need some kind of immune response for. And so lymph nodes serve very, very specific parts of the body. Lymphedema occurs after breast cancer because lymph nodes are removed from the armpit or the chest as a result of fear that there is cancer that has spread to that area. The issue is that those lymph nodes not only serve that area of breast tissue, they likely serve some area of the arm on that side as well. And so that part of the body that was served by those lymph nodes is forever altered with regard to its ability to respond to infection, injury, inflammation, and trauma.
My name's Mandy Coulafay. I have my doctorate degree in physical therapy, and I specialize in women's health physical therapy, and I'm also a certified lymphedema therapist. Lymphedema is an abnormal accumulation of fluid in a body part. It most often happens in an extremity, and it can potentially happen after breast cancer surgery and treatment. A diagnosis of lymphedema is usually made based both on subjective reports and objective findings. Lymphedema usually starts distally around the hand and the wrist, and people may say their watch doesn't fit quite right, or their rings are too tight, or they have difficulty getting on a glove. Occasionally it can start in the upper arm too, so symptoms of that would be if a person has difficulty getting the sleeves of their shirt on, like it's too tight for that. And lymphedema also may happen in the affected breast or the torso too. And lymphedema itself, it's not usually a painful condition, but people may report tiredness or heaviness or achiness in their arm. Lymphedema isn't a curable condition, but there are many treatment options available, and the treatment is individualized to each person. So at this point, I would recommend consulting with your physician or visiting a website, www.lymphnet.org, to find a certified therapist who can help you. Right now, it's the current recommendation that people who have lymphedema or who are symptomatic of lymphedema wear a well-fitted compression garment while they're exercising. A compression garment is something that is specifically measured for each person. In the case after breast cancer, it would be an upper extremity garment, which runs from the wrist to the shoulder, and then there's also a glove that goes with it too. It helps to get the fluid out of the arm and keep the fluid from reaccumulating. There's no universal way to prevent lymphedema, but there are steps you can take to reduce your risk of developing it. First is don't have blood pressures, IV sticks, needle sticks, blood draws, anything like that done in your affected arm. Be careful about getting a cut or a bee sting or a sunburn, things like that. If it's not treated, it could develop an infection, which can trigger the onset of lymphedema. In most cases, you should have full shoulder range of motion before starting weightlifting. So in most cases, you can't really start the weightlifting right off the bat because people don't usually have full range of motion. But doing weightlifting helps to increase the tone of the muscles in the arms. And as the muscle contracts, that contraction helps to pump the fluid out of the arm as well. So you have the contraction of the muscles coupled with the benefits of the compression from the garment.
Historic clinical guidelines for women after breast cancer treatment, including lymph node removal, have been for women to avoid use of that limb. In fact, to not lift anything heavier than 5 to 15 pounds ever again in their lives, which is a little silly because a gallon of milk weighs 8 pounds. My laboratory at the University of Pennsylvania initiated a trial called PAL, which stands for Physical Activity and Lymphedema. What we set out to do with the PAL trial was to see if twice weekly, slowly progressive weightlifting, like is done in the Strength and Courage DVD, would be safe. And if we could reverse these clinical guidelines for women who are at risk for or who have lymphedema. So we recruited 141 women who had lymphedema at the beginning of the study, and we randomized them and we placed them into the exercise group or the control group, and we gave them twice weekly exercise training for 1 full year. And what we found was that not only was it safe for them to do this weightlifting program, but we cut the number of lymphedema flare-ups that required medical attention in half. The results of the PAL trial have resulted in changes in clinical guidelines and the recommendations that are given to women on commonly accessed websites. The recommendations now clearly indicate that it is perfectly safe for women who have lymphedema and are at risk for lymphedema to do slowly progressive weightlifting after being cleared by a physical therapist. This is fantastic news. I am delighted to report that our second analysis of the PAL trial shows us that women at risk for lymphedema need not worry about weightlifting causing lymphedema, and in fact, what we found is that slowly progressive weightlifting for 1 year prevented lymphedema. We started the PAL trial in part because we were concerned that breast cancer survivors were avoiding all forms of exercise because they were being told not to do weight training. Now, what we know is not only are they not at risk for increased incidence of lymphedema from doing weightlifting, they prevent lymphedema by doing weightlifting, and thus all forms of exercise are open to breast cancer survivors, all 2.4 million of them alive in the US today. There are risks to performing weightlifting after having had lymph nodes removed. And so women do need to approach this sort of activity program with some caution. But approaching something with caution is quite different than avoiding it altogether out of fear of developing lymphedema. Women need to be evaluated by a physical therapist and hopefully by a certified lymphatic therapist to make sure that they do not have lymphedema or any of the other common arm and shoulder problems that happen after breast cancer treatment, to make sure that they're safe to start an exercise program with the upper body after they've had breast cancer treatment. Once you have had an evaluation by a qualified physical therapist, you want to start slow and progress slow as well. You start with very low resistance, 1 to 2 pound dumbbells, the lightest resistance possible for a given exercise. You do the exercises on the Strength and Courage DVD or the program that's been designed for you by a certified fitness professional for a week or two and see how your symptoms respond. If you're fine, if you have no change in symptoms, no change in swelling, heaviness, thickness, fullness of the arm, and no sense of hotness or change in temperature of the arm, then you can progress the weight by the smallest possible increment again. And so slow and steady is the way to go. You want to think of this as rehabilitation, much like cardiac rehabilitation is done. So in cardiac rehabilitation, you can easily see that you would not take someone who just had a heart attack and say, okay, let's go train for a marathon. That's the same idea for women who've had axillary node dissection or sentinel lymph node dissection with radiation who have risk for lymphedema, slow and steady. Since the publication of the PAL trial results in the New England Journal of Medicine, I have received over 500 emails, phone calls, and letters from women across the country and across the world who are clearly feeling that they are released from the prison of not being able to lift anything heavier than 5 to 15 pounds. Women write me and tell me that this has changed their lives, and we are delighted that we're able to change clinical practice with this important clinical trial. The Strength and Courage DVD recommends a holistic approach to exercise that includes aerobic exercise, weightlifting, and stretching. This is a fantastic combination that will help to rehabilitate the arm, will rehabilitate range of motion with the stretching exercises, and includes the aerobic exercise associated with overall survival.